Ugandan scientists are working on developing sterile male mosquitoes that are incapable of mating with a technology called gene drive. In this way, they will be cutting back on the birth rate, reducing mosquito populations and in turn malaria cases.
From the studies that have been done, one mosquito can lay between 200 and 500 eggs. So one mosquito can produce so many offspring. But if you can affect its fertility to produce, and it only produces maybe 20, that way you are reducing the numbers over time.
The research has now been expanded to 2 larger islands on Lake Victoria, an area with one of the highest rates of malaria prevalence in the country. The previous study was done on smaller islands, but the results were not satisfactory, prompting further research. The scientists hope to make a breakthrough with their gene drive technology, but this may take years of extensive research, and hopefully this could end the spread of malaria in the country. Regulatory checks are being done to allow mosquito eggs to be imported for breeding into the country from the Center for Disease Control in the United States. Their aim is to have results that can be applicable across the country.
We are still working at studying the local mosquito population that exists, understanding it thoroughly, but at the same time also doing studies in our insectary, which is a building where you can rear and study mosquitoes. It is contained so that nothing can escape, and it is regulated.
Uganda continues to record an upsurge of malaria cases despite different interventions like sleeping under mosquito nets and spraying using insecticide. The World Health Organization says Uganda has one of the world's highest numbers of malaria cases, with nearly 470 cases reported per every 1,000 people annually. Uganda also announced it will introduce the malaria vaccine into its routine immunization schedules with effect from April 2025. Isabel Nakiria, CGTN Kampala, Uganda.